Hello, good day, lovely viewers. I'm Lovina, the Livina, a midwife. You can call me midwife this morning. Well, I'm here to just talk to you briefly about breast cancer. I believe you've heard a lot of breast cancer. This month of October has been dedicated to creating awareness on breast cancer. And I just want to share something little with you. So, as we know, okay, breast cancer refers to cancer in the breast. Okay, if we talk of cancer, we are talking about abnormal growth of tissues in the body, or the abnormal growth of cells, okay, in the body. So, you'll be wondering who can get breast cancer. Some of us think that breast cancer is just for women, but then I would want you to know that breast cancer affects both men and women. Novinyen cho novinyen no. Another let's see if you have breast cancer. I'm a siame aton akwe. Devio, I'm a chicho. Everybody is at risk for breast cancer. Okay. So yes, everybody is at risk, but then breast cancer is more commonly diagnosed among the elderly, like 40, those in the 40s. But it doesn't mean that if you are less than 40 years you are safe. No. And that is why we need to screen ourselves for breast cancer. Breast cancer is not a death sentence. The fact that you have breast cancer doesn't mean you are going to die. Early detection saves, and that is why we are creating this awareness. So get your breast screened this month. And oh yes, every month remember to do your self breast examination. Learn to examine your breasts this and every month. For those of us menstruating, let's examine our breasts after a week after our menses. And then for those of us in our menopause, we can do that same day of the month, same day of every month. Okay, so that's the letter I want to share with you. If you examine your breasts and you see that there is any change in the size of your breast, there is any change in the color, there is any dimpling, or your nipple is discharging, if you are not a breastfeeding mother and then your nipple is discharging, probably with blood especially, then you need to see a specialist, okay, like a doctor or whatever. Just report to the hospital and get your breast screened. This month there are several hospitals doing free breast examination and screening, so get yourself screened.